When I first started seeing Dr. Moulton, I was really in a stage of life where my husband and I were trying to start a family. We wanted to get pregnant and we wanted to start a family. And so there were some issues that, were making that difficult and causing me pain. And I felt like he was treating me and my family as a whole. He was never pushing any particular surgery. And he knew exactly where we were in just trying to start a family and those kind of things. And I think probably one of the first questions he asked me every time he saw me is, where are you, with a family, how are things going, that kind of thing. And it was very just caring in that regard as well.
I think it's like any relationship in life. There's certain personalities that click and there's certain personalities that don't. I personally feel like I treat my patients more like I would a friend.
My family situation changed. My husband and I then looked at going to more adoption options. And with my history where it was and just kind of being in constant pain, that's when we decided it was okay to move forward with a hysterectomy.
When a patient comes to see me, such as Melinda, we've sat down and we've talked about all the options, from doing nothing all the way up to surgery and all the options in between. I think people come to see me because they know I do care about people, and I don't think surgeries are first and foremost option by any means. There's risk involved in surgery. There better be a big benefit or we shouldn't be talking about surgery. So I personally pride myself in talking to my patients and making sure that they are well aware of all their options.
Dr. Moulton made it very comfortable for me. He told me exactly what was going to happen. The procedure itself, I hate to call it easy, but for what I was expecting a hysterectomy would be like, so happy I made that choice because my quality of life is so much better than what it was before.
Obviously, she did very well, and most patients do after a robotic hysterectomy. The majority of patients rarely are taking pain medicines 1 week later, and oftentimes, when I say often, I don't think 52%, I'd say 95% of my patients have driven themselves to their post-op appointment. So it gives me great satisfaction to see these people engage back into their life without having to stay at home, sitting on a couch, ringing a bell for several weeks because they have a big abdominal incision.
The patient care that I received, not only from Dr. Moulton, but from his nursing staff and all the nurses within this hospital, I just felt really well cared for. And not just my physical care, but just everything as a whole person and as a whole family. They really looked out for my husband during this whole thing, and the people that came to visit were just really well cared for. So I absolutely recommend this hospital.